Hi, my name's David Denis. I'm a facilitator at the Center for Mindfulness Studies. I'm a naturopathic doctor, and I have a private practice here in Toronto that's focused in the area of mental health. I wanted to talk today a little bit about Bell Canada's initiative called Let's Talk, and it's really around ending the stigma that surrounds mental health and mental illness in particular. And I wanted to talk a little bit about the 5 steps that they outline in this initiative that we can all begin to work on and to look at these steps from the perspective of mindfulness. So the first step is language matters. And here Bell Canada really comments on the use of specific words in the way that we talk about things in everyday language that reinforces stigma. Words like nut, psycho, or crazy, which really reinforce a kind of stigma or negative perspective of certain types of mental illness or experiences that people who are mentally ill sometimes have. And from a mindfulness perspective, one way to think about this is that when we're practicing mindfulness, part of what we're doing is trying to step out of automatic pilot, the kind of automaticity that just gets us through our days and through our ways of speaking with others in the ways that we've just picked up over time. And we may not be very conscious in the use of our words and the way that we speak. And through the practice of mindfulness, we begin to start to step out of that kind of automaticity and to be really aware and a little bit more conscious of what we can put out in the world and how we speak, so that we can begin to use language that is more inclusive and at the very least isn't reinforcing of stigma. And so instead of saying things like, oh, that's crazy, or that person's psycho, to choose other kinds of words, or better yet, even to perhaps disengage from the kind of tendency perhaps to judge or criticize, or at the very least keep the kinds of comments that we make focused on specific behavior rather than using labels that reinforce stigma in mental health. And of course, this is a practice, and I think that's another perspective that mindfulness brings on all of these steps, is that really what we're doing is practicing, and it's not something that we adopt all at once, and either we have it or we don't, but just to see that it takes time to shift habits and shift patterns on a personal level, and certainly at a more national level, which is where this campaign is really trying to hit, improving the mental health of Canadians. The second step is to educate yourself. And here I wanted to offer a particular perspective on mental illness. At the center, we're really committed to acknowledging the kinds of conditions that the clients who come to see us are looking for help from. One very common condition that we see a lot at the center is major depression. And it's important to understand that major depression is a condition that exists. It's something that we can understand, that we can all identify with relative ease. But at the same time, it's also really important to realize that major depression is really just a label or a phrase that describes a set of experiences. And those experiences are very common. And in fact, those experiences fall along a spectrum that we all experience to different degrees. So major depression, one example of this is that in major depression, people often experience sadness on a daily level that's quite significant and gets in the way of living one's life. But of course, we all feel sad. We feel sad when we suffer a loss or really experience anything, even something small like just noticing a flower that's perhaps fallen off and is wilting away, or a sadness from watching a particularly sad movie. And that doesn't mean we're depressed. And what's helpful about this way of thinking, this seeing the phenomena of mental illness along a spectrum, is that it allows us to really bring a kind of common humanity to the way that we look at mental illness, and to see everybody on the same playing field, to understand that these experiences happen for many reasons, and some of those are things like genetics, the kinds of stressful events we may experience in our lives, and other factors, and that many of us may experience mental illness at different times in our lives, and to see that this is something that we're all experiencing on a day-to-day basis, which really helps us then to take the kind of stigma out of it that really comes from a place of separating ourselves from people who have mental illness to people who don't have it, to understand, oh, we're all on the same playing field, and some of us are suffering more intensely than others at certain times, and It's something that we can all experience. The third step is to be kind. And I think this really relates to mindfulness in particular, as well as to the last step that I spoke about in terms of understanding mental illness on a spectrum. One of the things that's going to really help shift the way that we relate to mental illness in Canada and on personal levels is to try to bring a little bit more kindness to it. And this is something that's explicitly a part of mindfulness. Mindfulness isn't just about focus, or it's not necessarily about relaxation. It's really about a set of attitudes and approaches that we bring to the experiences that we find ourselves in. And those attitudes include things like kindness, compassion, a kind of equanimity to the experiences that we feel, so that when we're suffering, we try to understand that suffering rather than quickly pushing it away or judging it. And so that when we see the suffering in others, we can bring the same kind of approach. And from a place of kindness and compassion, hopefully we can start to find and see more clearly the steps needed to help ourselves and others who are suffering from mental illness. Step 4 is to listen and to ask. And as much as at the center we really acknowledge the mental health conditions that people suffer from, we can all recognize the diagnosis of major depression. We all have to realize that anyone who's suffering from major depression is going to be suffering in their own particular individual way, and that we need to be really careful not to make assumptions about what the experience is like for that person, and also not to assume what the best form of help is for that person. And so it's important to ask questions about what's going on, what the experience is like, and to really listen, and to really be considerate that at times offering help can sometimes actually be unhelpful. And an example of this that I sometimes use in teaching is the idea of saying to somebody, oh, just relax. You know, if somebody's really stressed out or anxious, sometimes a friend may come to that person and say, oh, you just really need to relax. Take some time and relax. And if it were that simple, I think that person probably would be doing it already. And so it's really important to really consider, okay, what kind of help is required here? And perhaps to ask what's been tried before. And this is something that I think that we can do on individual levels in our own lives, and start to listen and to ask on a more societal level as well. And this ties into the final step, which is to talk about it, and to talk about mental health, mental illness, not just within ourselves, not just with our psychotherapist or our doctor, but at other levels in society, perhaps at the workplace, starting an initiative around mental health at the workplace, at school, at other institutions, so that we can start to destigmatize the experience of mental illness, to shine some light on the experiences that are so often wrought with shame. Shame being the emotion that we feel when we're convinced that there's something wrong with us. The fact that I'm depressed means there's something wrong with me. I should just be able to suck it up. And so this kind of shame and the stigma that comes with mental illness will really be helped by creating conversations at all levels throughout Canada. So those are some of the perspectives that I'm bringing professionally as a facilitator of mindfulness at the Center for Mindfulness Studies, in my professional practice as a naturopathic doctor. But I think most importantly as just an individual who's experienced mental illness in my own life, and my family members, and the people around me. And I hope this video has provided a bit of food for thought, and that that starts some conversations. And if you have any comments, let's have a conversation through the comments. Have a great day.